Good morning, everyone. Thank you for joining us. My name is Amanda Catalago. I am the Marketing Manager with the League of California Cities. And thank you all for joining us today for our Health Benefits Marketplace webinar, Active Employee Benefits Technology Solution. I'm going to start out with a little bit of housekeeping as usual. You are all in listen-only mode. So if you have questions during the webinar, please enter them into the question box. You can see a little image there of what that looks like. Throughout the webinar, we'll compile all those questions, and at the end, we'll read those off and answer as many as we can within the time we have allotted today. You'll also be receiving the recording of this webinar and the slides after we're all wrapped up. So I'd like to start off with a little background on the League's Health Benefits Marketplace. This was designed to help cities and all public agencies manage their unique benefits, contributions, and eligibility structures for active employees and retirees. The Health Benefits Marketplace was really designed originally to help cities address their escalating OPEB liabilities. This was a big issue, and cities asked the League to try to find a solution. So the Health Benefits Marketplace started there, and throughout that process, we realized there's a lot of other challenges that cities face when it comes to addressing issues with delivering health benefits to their active employees and retirees, such as limited resources for administering those benefits, reporting and requirements associated with the Affordable Care Act, and the lack of flexibility in the plan designs in CalPERS. So how we address these challenges? We created the Health Benefits Marketplace, and that's really comprised of two major components to help you address these challenges. One is a retiree solution, which allows you to transition your retirees to the individual market in the health benefits market. And through that, you can create or have more control over your defined contributions for your retirees, and thus helping you address your OPEB solution. The other part of the Health Benefits Marketplace is the one that we're going to focus on today, and that is the Active Employee Solution. And it's a benefits administration platform, which is powered by Connecture. We went through a competitive request for proposal, and they are one of our partners that we've chosen to help us power the Health Benefits Marketplace. And with us today, we have Patrick Kelly. He is from Connecture, and many of you have probably met him or heard from him in the past. He is going to talk about this benefits administration platform on the Health Benefits Marketplace. And with that, I'd like to hand it over to Pat.
Thanks, Amanda. Hi, everybody. Thank you so much for taking the time out of your day to learn a little bit more about the Health Benefits Marketplace and the technology solution that we have for you. So one thing that I think is on everybody's minds, and there's been some confusion about, is who can participate in the Health Benefits Marketplace Active Technology Solution. And so today, in terms of an agenda, I'm going to walk through what it is, who can participate, and give you an overview of some of the processes and timelines and different types of communication that is available for your employees if you were to participate in the active solution. So we'll start with who can participate. The League has allowed the Health Benefits Marketplace to be opened up to public agencies beyond just cities, so counties, special districts, school districts, and those that are in and outside of CalPERS. So today, in terms of the way that you can participate on the platform, it is truly going to be a technology solution that allows you to streamline efficiencies within your benefits administration. And it doesn't matter if you're fully insured, self-funded, you can bring your own carriers, and we can work with your broker or benefits consultant. So as you think about some of the tools that we talk about today, know that the platform itself and the solution itself is flexible enough to appropriately assist you in any number of ways, which we'll walk through. So what are the features that are available? So Amanda mentioned we have benefits administration, we have online enrollment with decision support, we have consolidated billing and billing reconciliation, Affordable Care Act tracking, reporting, and e-filing, and wellness, all available as tools that truly are going to revolve around the baseline technology of the benefits administration. So the way that we are able to leverage savings for employers and agencies like yourself is taking all of these administrative efficiencies, the ability to create flexible plan designs, the ability to really have a focal point on your specific strategy and be able to support that strategy for your benefits as we go through, as you go through changes, as you may have additional benefits that you'd like to add for your employees. The bottom line is we have consumer-driven technology that helps people make better decisions, and really the goal is twofold: taking burden off of HR and helping employees make decisions when additional choice is included. So some sample results after implementing the platform are, as you expand choice for your health plans, you can maintain those plans that you currently have today and add them. We'll go through some scenarios that we've found are really based in all of the conversations that we have with all of our partners and all of the folks like yourselves. But as you start to look at the tools, and we'll go through a demo at the end of this presentation, 13% of employees enroll in less expensive plans. They find that they're overinsured. They find that they'd like to potentially save money for additional benefits. The great part about the platform and the shopping side is you can continue to add more and more benefits to your portfolio offered to your employees, and it does not increase exponentially the administrative burden that you have in actually delivering those benefits to the employees. So we see people saving an average of 30% in terms of time spent administering open and going through open enrollment, administering life change events and new hires throughout the year. So think of it in some broad number terms. If you spend 1,000 hours a year on your benefits, we can save you 300 hours, and you can potentially use those hours and time saved to revamp your comp plan, focus on retirement, focus on initiating a wellness program and options like that, and even save time for the ACA reporting and requirements as well. So I mentioned that this is really two prongs. So the platform itself has, you select the benefits as the city, as the benefits administrator. Employees come in, they can review those benefits, they can use our decision support tools to help them better understand their health plan options. We can embed videos and additional calculators and things like that to really help those employees maximize the value of the benefits that are being offered. And on the other side, helping your team managing new hires, life changes, corrections, evidence of insurability. All of the enrollment data is going to be sent to carriers via an EDI process. So it's all electronic enrollment. And we provide a very comprehensive reporting base that allows you to access any number of data points that you can think of. So I mentioned some of the scenarios. So what we're finding is agencies are very interested in a stepping stone approach, implementing the technology with their current benefits and then having the ability to expand choice and increase consumerism down the line is something that we've found is very desirable for the vast majority of agencies that we speak with. So in terms of that scenario number one, keeping all of your benefits, helping your employees enroll online, streamlining some efficiencies, taking advantage of the decision support technology, and being able to plug in ACA reporting and potentially starting a wellness program are all things that you can do as a first step into utilizing a platform like this. So expanding choice, this can mean a variety of things. Today, we have a variety of built-in plan designs from many of the top carriers. So carriers will allow you to build in more choice for your employees, and we help them make sense of those choices as they are going through the enrollment process with all of the different tools that we have available to them. And then finally, increasing consumerism, helping people better understand high deductible health plans paired with tax advantage savings accounts, and ultimately managing costs through changes in behavior and helping them better understand how to maximize the utilization of those plans. So some things to think about when you're looking at whether or not this is something that you would like to further explore. How do you enroll and administer benefits today? Do you use a paper process? Do you use older legacy technology? Are you already utilizing some additional technology, newer technology? And understanding what the return on investment is for this technology within your department is a key piece to being able to look at budget, look at the process, look at what your agency is actually trying to accomplish with your benefits strategy. And we can help you discuss and uncover what that actually might mean for you through a detailed analysis of what you're currently doing today. And then finally, do you need to go through an RFP process? The League has put together an agreement, and once Connecture was chosen, the goal was to have an agreement that would be very easily accessible for cities and other public agencies to utilize, and by design, ideally make the RFP process and contracting process much easier. But as you go through this, the decision process can differ from small to large agency and just agency to agency in general. So understanding the budget, understanding who the decision makers are within your organization. Do you need city council approval, and what is the implementation timeline? So in terms of those decision makers, if you have benefits committees, what is the contracting process? What's your procurement process? Is that going through a separate department? And all of these things are key factors in understanding how we can potentially implement this solution for you and your employees. So speaking of implementation process, this can typically range from 6 to 12 weeks. So this is an example of a typical, more complex process. So today we have our first city actually being implemented and going live next week, the city of Stockton. So we've went through this process. They actually had to go through an RFP process as well. We were chosen as the solution through that RFP process. We worked closely with their benefits consultant and presented to their benefits committee and ultimately won the RFP. And so the initial call was introducing our team, understanding what the benefits are, and they are actually bringing all of their current benefits, as I had mentioned earlier, that scenario number one, as a stepping stone process. So they were actually about 1,600 or so active employees, and they have currently, I believe, 5 health plan options, 2 Kaiser HMOs, a Sutter HMO, and a PPO. So when we start this process determining all the data that we need to understand how you look at your employees. So turning a potentially gray process in the paper world into black and white rules within the technology allows for you to utilize and leverage the flexibility of the platform to match exactly what you need in terms of the different bargaining groups, all of the different levels of contributions and years of service, and however you are working with your employee groups today, we can support that on the platform. And then finally, we go to work. We build all of the electronic eligibility to the carriers, focusing on getting those enrollment files set up, go through testing, and during open enrollment, we assist with employee communications, support, and different questions to help your HR team, small or large, make sure we have a successful open enrollment. And outside of the open enrollment period, employees can come back in, they can see their current benefits, they can, there's a lot of flexibility, so I will demonstrate that shortly as well. One of the biggest hurdles in any technology implementation is going to be communication. Communicating with employees, the benefits outside of open enrollment, going beyond online enrollment. Connexure is here to support you and your team in any way that we can, if that is helping with designing webinars to announce this to your employees. We have a whole library of instructional videos and information that we can utilize and leverage to help you get the word out. Our enrollment site is also mobile adaptive, so if you have tablets, if you have computer banks at the city, to allow for people to come in who may not be computer savvy, and enrollment can actually be done on the back end of the system as well. So if you are a larger city and would like call center support, we have those available as well. So again, what the goal is no agency is the same. So going through a consultative process with you to make sure that the technology is going to fit your needs and desires is going to be an important conversation. So in terms of implementation, on average, it's about 18 to 20 hours spread out over those 3 months. We don't need your IT resources. This is all cloud-based technology. So your internal systems, outside of maybe if we're going to be integrating with your payroll system or things like that, IT resources aren't needed. This is totally cloud software as a service. So items we need from HR or the broker are plan documents, rates and contribution information. We have an approximately 2-hour discussion on the structure of benefits. So as I mentioned, payroll groups, benefit classes, divisions, departments, locations. And then we help you complete carrier benefits workbooks. So all of the plans that you have in place, go through review and testing with you and your team, and then also provide training for the benefits administration platform. And that's ongoing. You have an account manager that you can leverage for assistance as well. So I'm going to pause my screen for a second here and pull up our site for demonstration purposes. Are there any questions at this point in the presentation that we can address? Looks like we've got one here.
Yeah, hi Pat. We have a question here. Can you let us know if JPAs are allowed to participate in the health benefits marketplace?
It's a great question. So we've been in discussions with several JPAs across the state. So it is something that we can follow up with you, and but it is absolutely a possibility to participate if you're in a JPA. Okay. So this is going to be the employee-facing experience. What we see here is the ability to brand the site to your city. When the employees come in during the open enrollment period, they'll be able to create an account. The account creation is very easy. We provide, again, instructions, webinars. We can set up a lot of different educational avenues for your employees. And once they are all ready to sign in, this is going to bring them to their homepage. So the homepage is going to be different whether or not you're in open enrollment or outside of open enrollment. During the open enrollment period, employees can come in and out as they please, and ultimately our goal as an organization was to create a user experience that is very retail-like in terms of the enrollment. They can see what their current benefits is. We have an optional service to preload those current benefits. The first time that they log in, they would also be prompted to enter their dependents, or we would be able to preload those dependents. We can customize our resource center. So if you have different information that you would like to have available, MOUs, different plan documents, information on your deferred comp enrollment, we can customize this per agency. And they can have basic questions answered, just as simple as maybe you're rolling out an HSA, and we want to understand what that means. So when they're ready to go shop, the shopping page is going to be, again, our focus has been to allow for employees to be more consumers, more like consumers of their health care, by helping them with a variety of different ways to educate themselves about the different benefits that they have today. So we break out benefits into a couple of buckets: protecting your health, income replacement. You'll see that we have these already checkboxed if they're employer provided. The plans that we have available are going to be only based on the eligibility of that employee. So if there's no spouse or child, you won't see spouse or child options. And again, you can also enroll in your tax advantage accounts and integrate a wellness program, as well as have the opportunity to provide your employees with some additional voluntary benefits that you may not have today. So the very first thing that the majority of employees are going to look at are their medical options. So one of the things that we've done is in providing a retail-like shopping experience, we also have this decision support recommendation engine that helps employees better understand the benefits that they're enrolling in. So again, as you continue to strategize about what types of benefits and plan designs to offer your employees, it's not necessarily going to be a one-size-fits-all. But as you add plan designs, you add additional burden to help your employees understand them and maximize the value of those plans. So as we go through the decision support, we ask the employees a couple of questions. How do you want to balance your costs, and how do you typically use healthcare? And basically, we're going to give them the option of using a national average or estimating their own utilization. So doctor's visits, I know my wife and son go more than 3 times a year. I know my wife and I also go ahead and we have a couple of prescriptions. Emergency room visits, knock on wood, we've only been there once. Inpatient and outpatient visits, we don't have any planned. So when I click Get Recommendations, this is going to drive our recommendation engine to rank order those plan designs based on the preferences that the employee input. So we're also taking into account their age, gender, location. So as you look through the options, you're going to see the minimum cost, which is premium only, the estimated likely cost, which is premium plus an estimated cost for care. So based on who you are, how you use the product, this is what we would estimate you would spend out of pocket on this plan. And then your maximum cost. You can scroll down and get additional information. You can also download the SBC. So this gives you the opportunity for those employees that really need a lot of different healthcare needs. They can dig in as deep as they need to make those decisions. And they can also compare and contrast plans up to 3 at once. So if we look at the plan comparison, we can see that although I'm spending the same in premium, this is going to actually have less out of pocket for myself. So I can go down and I can take a look at what this might be. This is an HSA plan. This is the traditional PPO plan. So as we are scrolling through the options, we can print this. Prints off very neatly and legible. So I can print that off and take it home. And I can also access this from home as well. So if I'm doing this on my lunch break or what have you, I can go ahead and bring it home. So once I pick my plan, I'm going to continue on, and it'll take me out to the remainder of the benefits, and I can continue my enrollment. I'd like to watch a video on what dental coverage is and how this is going to affect me. I can do so here, and then I can, again, continue on with the remainder of the benefits available. Throughout the process, it's going to help me with the total cost, total contributions, and what my total cost is going to be. So once I'm ready to enroll, this is going to my final confirmation page, where I will be able to designate beneficiaries for life insurance, enroll in, choose a primary care physician, and a variety of other actions that that ultimately are going to help with compliance and record keeping on your end as HR professionals. So as I continue through here, again, designating beneficiaries, this can be selected and is very easily reported on. So when we talk about the back end of the system, all of these data points can actually be reported on. And so if I'm going to waive the remainder of these coverages, I can do so like this and submit my enrollment. And this is going to allow me to print off my confirmation page and give me the ability to come back and see these benefits through the remainder of the year. So once open enrollment is closed, then when they come back throughout the year, they can come to My Benefits and view your plans. If they have a life event, they would be able to come back outside of open enrollment and complete that life event online and submit any documentation needed based on what your specific rules are in terms of those life events, as well as the plan rules. And they would also be allowed to come back and look at all the different information within the resource center. So ultimately, the goal is to create a hub for which your employees can have access to benefits data without having to scramble all over the web or go to multiple websites. We can actually house some information within the site to help consolidate the places that they need to go if they have questions about their benefits. So that is going to be the employee-facing front end of the system, in which you would, again, all of your employees would have access to. And I'll go ahead and pull up our portal for the employer as well, and we can walk through this quickly. So this is going to be where your staff is going to have access to reporting, life change events, different levels of security permissions. So as we log in for the first time, we'll notice that we have a dashboard. So when I have new hires, when I have pending items that need my review, that is where these will show up. I have pending underwriting decisions. So maybe I have offered for the first time a benefit that has the need for evidence of insurability in life insurance. We can see all of that pending here, and we can also see those employees and what they have actually currently enrolled in and what that spend is. Also being able to print confirmation statements from back here. From a reporting standpoint, we have a variety of baked-in reports that really allow for you to have access to any data point that you need. We're able to use open enrollment status to help remind people that they are in need of coming in and enrolling in their benefits, carrier enrollments, dependent information, eligibility information, employee birthdays, if you need to notify folks of their eligibility for Medicare, things of that nature. And we're also here to help in terms of a certain basic level of email support for those employees. So during open enrollment, we can send out reminder emails and help people better get it done, so you can actually shorten that enrollment time, the open enrollment window, for up to 50%. And so with that, that is a brief overview of the health benefits marketplace and the Connecture solution. I'm just going to pause my screen one more time here, and we'll go ahead and take any additional questions. Looks like we've got a few.
Yeah, thanks, Pat. I appreciate you going through that demonstration. We do have a few questions here, and just as a reminder, if you have any questions, please type those into the question box, and we'll get those answered for you. And also, you will get a recording and the recording of the webinar and the slides after we've wrapped up here. So, Pat, the first question I have here is if the health benefits marketplace can work with the city's broker, their benefits broker, and maybe you can talk a little bit about how that works.
Sure, absolutely. So we are absolutely broker friendly. So if you have your benefits consultant, many times these decisions are made collaboratively with your benefits consultant or broker to look at programs and technology like this. So we work with any and all benefits brokers, and really the process comes down to If you have questions about this, if you'd like to include them on initial conversations, we're happy to do so and go through a similar presentation like this and help them understand some of the options that they have as your benefits broker to interact and help strategize around different ways to leverage the technology available through the health benefits marketplace.
Great, thank you. The next question we have is, do I have to change my current benefits offering?
No, you do not. The beauty of the platform is it is able to give you the flexibility to keep your current benefit offering and allow for you to truly have a strategic approach to your benefits and give you some additional, again, flexibility to potentially add more robust benefits to your portfolio available to your employees without, again, creating more and more work for you and your HR staff.
Thanks, Pat. Looks like we have a couple other questions here. The next one is, do we need to offer both the employee and retiree solution together?
No. So they can be separate or they can be offered together. The active employee solution in terms of the group benefits administration can be offered as a standalone, and we also have modules for wellness, Affordable Care Act reporting, spending accounts, FSA, HSA, and that can all be pieced together and does not have to be offered directly next to the retiree solution. So they can be offered separately.
Right, thank you. And I'd like to point out that, for example, we do have a city who has signed on just for the ACA reporting alone. So as Pat said, you can really customize this to your needs. Okay, so the next question is, do you coordinate with CalPERS for changes, life events, etc.?
Yes. So we are working on a program in collaboration with the League and many cities that are a part of CalPERS to put something together that would allow for a variety of different administrative efficiencies and enrollment opportunities for CalPERS cities. So we'll have some more details on that in the coming months here. As we get closer to the deadline for CalPERS rates to be released. But if you have questions specific, we'll have up my contact information, and Amanda's up here at the end of the presentation, and we can specifically set up some additional time with you after the presentation.
Great, thank you. The next one we have here is what cities are or will be using the health benefits marketplace?
So today we launched the health benefits marketplace late last year in early September and went through an RFP process with the city of Stockton and are implementing them today. As many of you may know, many cities like to be the first second. So as we have a successful implementation here, we expect to see much more adoption as folks are able to learn from the experience of the city of Stockton. So today we have many cities that have interest, and our very first city will be going live in a week.
All right, and the next question is, Pat, can you talk about the cost of using this administrative platform?
Sure. So the cost is going to be based on the size of your city. We have tiered negotiated rates that the league has pre-negotiated for us. So what we can do is, if you have specific questions, we can, again, set up some additional time separately and provide you with a custom proposal that would outline all of the costs that are included in the for the platform and all of the other tools that are available as well.
Great, thanks, Pat. So that is it for the questions. If anybody has any more, please feel free to type those in. Pat, if you want to advance to the next slide, there you'll find contact information to get a hold of us if you have more questions. We're always happy to have conversations about the health benefits marketplace and answer any questions you have. Pat, is there anything you want to add before we wrap up today?
No, again, I thank everybody for their time. It's greatly appreciated. I know you are all very busy professionals, and we look forward to talking with you more about the marketplace at a future date.
Great. Thank you so much, Pat. And again, thank you all for attending. We hope you have a wonderful day.
Thanks, everybody.